Hey guys, welcome back to my channel. For this video in my series of our introduction to permanent makeup art, I want to go over the side effects, the ugly side of permanent makeup. Now, anytime you get a procedure, you're always taking a chance that there could be a possible side effect. I'm a licensed esthetician in addition to being a permanent makeup artist, and I want to share with you some possible side effects that you may face when you make the decision to do a permanent makeup procedure. And like with everything else I discuss, this information pertains to all women and men who are considering these types of procedures, whether you are on the lighter scale to the more richer in pigment. I mean, these videos are going to be for you so that you can make the most informed decision about this procedure. So let's begin. Now, I must warn you, I will be going through some pretty graphic topics. If you are sensitive to discussing STDs or anything like that, please turn off the video now. If you would like to continue, we're going to start with one of the most important potential side effects that you could have if you are doing a lip procedure. That means that you are getting permanent makeup on your lip to change, alter, correct the color of your lip. Whether you're darker skinned or lighter skinned or anything in between, you need to consider that there could be some potential issues with this particular topic. And what I want to talk about is herpes. Many of you know herpes as a sexually transmitted disease. Some people call it fever blisters, but herpes is herpes, and there's herpes 1 and there's herpes 2. There's the herpes 1 that is the culprit for fever blisters or cold sores, typically found on your face, near your cheeks, your nose. It can be anywhere on your face, but it typically affects the upper part of your body. Okay, that particular herpes strand tends to be reactivated when doing lip procedures. So what does that mean to you? Do you have herpes? Do you know that you have herpes? More people are walking around with herpes that do not know that they have it. And when they get these lip procedures, they get a breakout and they're flipping out thinking that it's the fault of the tech, and it's not. You know, your tattoo artist or your permanent makeup artist is not going to give you herpes. Herpes is skin to skin contact of somebody who has an infection or has an infected area, and sometimes it's passed through birth, sometimes it's sexually transmitted, sometimes it's just a kiss on someone who has an activated sore. Many people have it. It's pretty normal, it's pretty common. But when you're doing a lip procedure and you 2 days later get, a breakout on your lip, the best thing for you to do is to treat it with antivirals. Or if you decide that you want to do it the natural way, that's going to be between you and your physician. You would do that. And also, in order to kind of prevent that, if you know you have herpes 1, you would take your antivirals before your appointment and definitely take them after to prevent that, because too many of the breakouts could affect the healing of your lips. But in all, I mean, that's one of the effects of putting trauma on your lip. I mean, you're putting a needle to skin, and herpes is a possibility. If it's been dormant for a while, and many times it is dormant in all of our systems, we have no idea, but it's nothing to be afraid of, but it's everything to deal with. Like, you deal with it, whatever that may be. So, with my clients, I do have this talk with them during our consultation. Obviously, no one has to give me that information, but I always make it a standard procedure to discuss the possibilities of a herpes breakout. So now that we've gotten that out of the way, the next thing is hyperpigmentation and hypo-pigmentation. Hyperpigmentation is the excitement of melanocyte cells. I know I said that wrong. Melanocytes. But anyways, the melanin in your skin, which most of us have melanin to some degree, due to trauma, it tends to create more skin cells and the darkness around trauma. And I'll tell you, I have hyperpigmentation around my jawline. So anytime I get like a cut, a bump, or a bruise, it turns a darker shade of brown. Now, with lighter toned skins, that's not typically a problem, but we do find this with our, our Fitzpatrick 4s and 5s, 6, and 7s. If you know the Fitzpatrick scale, it's just Google it. It's a scale that shows kind of like different skin tones and how sunlight affects it. So I would be considered a Fitzpatrick 6. or some may say a 5, whichever one. I do not burn in the sun, but I do experience hyperpigmentation. Hypo-pigmentation is the opposite. It's the lightening of the skin due to trauma. And sometimes people with lighter skin tones experience this where, and some people with darker skin tones experience it, where you will have gotten your brows done and then the corners like start to peel off and there's like white blotches and you're like, what the heck is going on? Like, am I losing my skin? And that is nothing to be worried about at this point. It's how your skin heals. Even with hyperpigmentation, at some point, if you don't expose the area of hyperpigmentation to the sun, it will go away. If you let the hypopigmentation, the lightening of the skin, heal, eventually it's going to turn back into the color of your skin. And I'm not a dermatologist, but I am an esthetician. And when we're working with the skin in reference to tattooing, there's so many things that could possibly happen, but the skin heals, and that's the most important thing to understand. The fourth thing on my list, now that we've discussed herpes, hyperpigmentation, hypopigmentation, we're going to discuss keloids and scarring. If you have a scar that has a thick covering over it or a thick like scar tissue over it, most likely that's a keloid. Keloids happen on your ears. They can happen on any place that you have trauma. And it's important that when you go for your procedure, you let your technician know if you're prone to keloids. Now, sometimes you can get keloids on your hands and even some places on your body, and your brows are just fine because of the type of skin tissue it is and the fact that tattooing is not as traumatic as an actual scar with a sharp item. So if you get keloids, that's something to definitely let your technician know. That brings us to scarring. Scarring, you'll have more of a possibility of scarring with microblading. That's the tool that you use on your eyes to, on your eyebrows to create those hairline strokes. Because you're making that tiny cut when you go for your touch-up, if you go for more than 2 touch-ups with microblading, you are taking a chance that you could develop scarring in those little lines that they make. In reference to using the tattooing machine or the cosmetic tattooing machine, you do stand a less chance of having scarring unless you're going to your touch-up too frequently. Like you're supposed to do it once a year. If you're going once every 6 months, you could be prone to scarring. Plain and simple. So that's something that you want to think about, okay? The next thing is color changing. I mean, pigment is very stable, but over time, when your work fades, you do stand a chance that it could change color. It could turn a pinkish tone, it could turn a grayish tone, it can turn ashy, it could turn green. I've seen some pretty crazy colors, and that's just the life of your pigment. I mean, pigments are made of a combination of different colors of the spectrum, and over time, when your body processes and disposes of excess pigment particles, there are certain colors that are just left. And until they come out with a pigment that doesn't do that, I mean, we will have to make sure that, we as technicians do our best to come up with the right combination of colors so that you will heal as best as possible. But you have to go for your annual touch-up to make sure that your color is fresh and not faded and it's not having any funky colors. And old school permanent makeup, you'll see ladies with like these crazy colors on their brows, and that's because back in the day they used a lot of these tattooings that were pretty harsh that didn't work well or didn't age well with certain skin tones. So keep in mind that your brows will change color over time. That's just the reality of it. Last but not least on my list is medical treatments and chemotherapy. Like if you're currently undergoing chemotherapy, or you are diagnosed with a certain type of cancer, and you have to do MRIs and things of that nature, it's important to let your doctor know that, hey, I've had my brows done, or I am considering getting my brows. Can I do that? Now, typically when you have situations with immune suppressing diseases, you would want to definitely inquire about having a treatment with your doctor, because we are putting a foreign agent into your skin and your body has to heal it. And if you are immunosuppressed, you could open the whole door to infection and slow healing process. And cirrhosis of the skin, and various different complications. So make sure that you, if you're under the care of a doctor, you discuss this with your doctor so that you both can make the most informed decision. So I hope that you found these topics very helpful. I know there's probably so much more to discuss, but I figured for me, this is the most important thing to talk about in reference to permanent makeup and its side effects. And one of the greatest benefits is that you get these beautiful results. And you know, anything you do in life, there's always going to be a pro and a con. And I hope that you can take these different topics and discuss it with your technician if any of them apply. Once again, this is Selena from Norvana Beauty in Stuart, Florida. I would love to connect with any fellow artists in the area. Please like, subscribe to my channel, share it. I'm on Facebook and Instagram as Norvana Beauty. Check me out. That's not N-I-R, it's N-O-R-V-A-N-A Beauty. Okay? You guys are wonderful. Till next time.